And joining us now, Chief Executive Officer at the Lincoln Community Hospital and Care Center in rural Colorado, Kevin Stansbury. Kevin is the author of a recent guest essay for the New York Times entitled "What Medicaid Cuts Would Do to My Rural Hospital." In it, Kevin writes in part this: "The proud conservative residents of our community often feel left out of Colorado's more liberal politics. Our voices never seem to be as loud as those in metro areas of the state, and yet, with the looming threat of Medicaid cuts at the federal level and budget proposals that would cut rural health care, we're wondering if our voices are heard at all in this Republican administration and Congress. The nation's food and fuel are sourced in rural areas. Supporting rural communities should be strategically important, and they can't thrive without health care. I know the financial peril my hospital will face if our Medicaid lifeline is severed. But the real damage, the kind that keeps me up at night, will be done to the hard-working people in my rural community." And Kevin, thank you so much for coming on. Could you tell us more about what you think is at stake for the people that your hospital serves?
Good morning, Mika, and thank you for that summary of the article. I think it's first important to understand the nature of rural hospitals. Many rural hospitals in Colorado and across the country are independent community hospitals. We're not affiliated with systems. We have boards that are appointed from the community, and we're really trying to take care of our community members. We're also very geographic dispersed. So in my hospital, we serve an area roughly the size of the state of Connecticut, but there's only about 2 people per square mile in there. So what that creates is this dynamic where the hospital ends up, because of its community focus, we end up offering a lot of services that may not be financially lucrative, but are necessary to support the members of our community. So services like long-term care, services like home health, ambulance services. Many of those services are not necessarily financially sustainable on their own, but we offer them anyway because they're important to our community members. Without the Medicaid funding for those services, that's going to put rural hospitals in an even deeper hole, a hole that has been growing since the end of the pandemic. So we have to figure out a way how to continue to offer those services in rural communities, and at the same time, take a look at what's the best way to manage these Medicaid costs that the Congress is trying to look at right now.
Yeah. I mean, if they weren't able to access the care that they need at your hospital, where would residents in your community go for health care?
So the next nearest hospital to us is roughly 85 miles away in either Denver or Colorado Springs. They're about equidistant from us. And so what that creates is patients don't often go into the city because they're busy working at their jobs, either on the farm or the ranch. So if we don't offer care locally, often that care goes away. And some of the most important care that we offer is services like primary care and chronic disease management. And I would suggest that there's an investment in paying for those services because we can provide care at a relatively low cost to manage those chronic diseases instead of letting them become more acute when they really have to then present to the emergency department at a much higher cost of care.
Kevin, Simone Sanders Townsend here. You know, last night on our show, we talked to a Republican congresswoman from Indiana who said, look, they really want to make the benefits better for people and to crack down on the companies and the hospitals that take advantage of folks. But I just want to cut through the mess for a little bit. What would it mean if Congress ended up putting a cap on the amount that the federal government sends to the states for Medicaid patients? Would your state be able to make that up so that folks don't lose care? Can you guarantee that?
No, I don't think anybody can guarantee that. And I think all of the states, especially Colorado, what I know most about, the state would be hard-pressed to make up the difference from the federal government right now. Promises were made. Programs were developed based on those promises, And that in Colorado and in my hospital, those funds that we get from Medicaid keep our doors open. About 25% of my revenue is from Medicaid. If that's materially impacted, I can't offer the services that we continue to offer. So again, as Mika pointed out earlier, either those services simply aren't available to those patients, or patients have to travel, an hour and a half to get to the next closest care site. And I want to give an illustration. So for example, we just started a very small infusion therapy program to provide chemotherapy for patients with cancer. If any of you have had a loved one with cancer, or hopefully not, that you've experienced that, people tell me that one of the worst times of that is the travel back home after the chemotherapy treatment. Can you imagine having to drive an hour and a half after you've gotten chemotherapy just to go home? And again, patients sometimes choose not to seek that treatment then. And I think it's important for us all to realize that it shouldn't matter where you live if you live. And so we just are trying to offer those same basic services that are essentially funded by Medicaid to keep that care coming to the patients in our community.
Chief Executive Officer at Lincoln Community Hospital and Care Center in Hugo, Colorado, Kevin Stansbury. Thank you very much for making your case here on Morning Joe today. It's good to have you on.